So my gardening friends aren't going to like this either. When it comes to cannabis use in breastfeeding, there's really three things that we have to consider. One, does the THC pass into the breast milk? Two, how long can that remain in the breast tissue? And three, what is the effect on the baby? For the first point of does THC go into the breast milk, we have very clear data on this, and the answer is yes. THC does go into the breast milk. This is a summary that you can find on the NIH. There are many studies listed and summarized for you to read about how THC does pass into the breast milk. The logical question to ask is, how much time do I have to have it be safe to go from smoking to breastfeeding? And this is where my gardening friends get really upset, because in comparison to alcohol, which has a very short half-life and doesn't stay in the mother's body for very long, THC stays in the maternal body much longer. The duration of detection of THC in the milk has ranged from 6 days to greater than 6 weeks. The last question to ask is, how does this affect the baby who's drinking the breast milk? And this is where it gets really frustrating, because we don't have great data that tells us really the effects of this long term. So there's one study that was done that did show that it slowed down the motor development of the baby, but then another study showed that there was no differences, but then they said the limitation was that it wasn't a long-term study. And a registry study out of New Zealand showed that it may increase the risk of autism, but again, those aren't great studies either. So the stance of the major medical organizations is, because we don't have good evidence of long-term safety of use, we really recommend abstaining during breastfeeding. As always, it's doctors' jobs to tell our patients the risks, the benefits, and the alternatives, and it's our patients' jobs to decide what is the right option for them.